the dialogue series which is going on with IAQC, and I welcome to our respected director, sir, for joining this expert talk. And I also welcome to faculty members, IAQC coordinator Dr. Siddharth Main, and all the other faculty members and their students. So, firstly, I welcome to director, sir. Please, sir, you say few words and bless us.
So thank you very much, Dr. Samsherji. First of all, I welcome today's expert and very dynamic, renowned person and very knowledgeable Dr. Anoop Kumar ji. So from core of my heart, I welcome at ISF College of Pharmacy. I also welcome all the coordinator of this dialogue series, coordinator of IQAC, Dr. Samsher Singh ji, Dr. Siddharth Mehan, and some of the faculty member as well as the guest, those who are the present on the online platform. So, Dr. Anoop ji, the purpose of this series, the main purpose of the series, because I want to identify some of the peoples, they are doing the very specific work. And number of time, let us consider you are working in the Delhi and I am over here. So it is very difficult to the connect of the students, but we can connect to you. So this is the recorded talk, and precisely we can complete within a 30 to 35 minute, maximum to the 40 minutes, and it will be the upload on our YouTube channel. So I hope maximum student and faculty member, they will take the benefit. And I request to the coordinator, this talk is not interactive, you can say not a dual mode. So student, they want to ask the question, they only write down the chat box, it will be the clear after the completion of the lecture, because the purpose behind of this lecture is the only and only very precise, and it can be put on the our YouTube channel. So those who want to go through, they can direct interact with the, you can say, speaker, or they can send their queries on the chat box like that. So I hope that I know Dr. Anoop, he is the very capable person, and the title selected by the Anoop ji, it is very important. And number of time I feel that one of the scientists in the Naipur Mohali, Madam Ansal, she is the given in the topic. Even I am also very interested of the meta-analysis principles and techniques. So I request to all our students, listen carefully, and this types of the thing, it will be the very helpful to each and everybody. So thank you very much. Thanks to all, and over to Dr. Samsherji.
Thank you for your precious words, sir. So, just coming to the briefing about Dr. Anoop. Dr. Anoop is currently working as assistant professor in Department of Pharmacology at DIPSARU, New Delhi. He was earlier assistant professor and head in the Department of Pharmacology and Toxicology at NIPER. Before than that, he was officiating head and associate professor at Department of Pharmacology, ISF College of Pharmacy, Moga. He also worked in Department of Clinical Research in some pharmaceutical industrial limited, and he completed his master from the Jamia Hamdard University and PhD from the BITS. He authored number of research papers and more than 20 books. He's having a very good H index, which is 22, and I-10 index is 44, with a citation more than 1600. He had more than 3 Indian patents and guided nearly 38 postgraduate students with 2 PhD students. So, without taking much of time, I welcome you, sir. Please continue your talk.
Thank you so much, sir, for kind introductions. And first of all, I would like to thank worthy chairman, sir, director, sir, GD Gupta, sir, vice principal Narang, sir, for giving me this wonderful opportunity to interact with all of you. It's nice to see after a long time to all of you through online mode. And I wish I could visit the ISF Moga also whenever I will get the opportunity. And it's always been a pleasure for me whenever I am able to be a part of any event which is conducted by ISF College of Pharmacy Moga. And this is the institute where I started my academic journey. And I have learned a lot of things from Gupta sirs and all other faculty members who are there. So thanks again. And before I am going to start my presentations, I am going to specifically talk on meta-analysis, what actually it is, and what is its principle and procedures. So can I share my screen?
Yes, yes, sir.
Is it visible?
Visible, sir, visible.
Okay,
Yes,
okay,
please
okay.
continue.
Thank you, sir. Thank you for the confirmation. So, students and faculty members, as I said, today I am going to specifically talk on what actually the meta-analysis. So you will get an idea how to do it. I have involved some pathways also, whatever the steps which we are doing in the meta-analysis and what actually it is. So what actually the meta-analysis is, as I have highlighted, that it's a quantitative approach. So quantitative approach means we have to we talk about some data, and from where we will get this data. We will get this data from the research study. So it's a quantitative approach where we are doing the analysis of the research data of the clinical trials, as well as we can do meta-analysis for preclinical studies also. Sometimes many students have queries whether we can do for animal study. Yes, of course, if you go through a literature, you will find publications on meta-analysis of animal studies also. So purpose of meta-analysis is it's a quantitative approach. You are pulling the data from the research studies, and then you are making one conclusion out of it. And that conclusion should help the clinical decision making. That's the important objective of any meta-analysis is. But before doing the meta-analysis, you have to do the systematic literature search that we called SLR. Maybe many of you might have heard about SLR nowadays. During the COVID time, many SLR has been published, of course, meta-analysis also. So SLR, as its name indicates, it's a systematic literature research. Literature search is different, that we call narrative review, that we are writing on any particular topic and experts are particular writing on that particular topic. But systematic literature review is something different from the narrative review. As its name indicates, you have to be do the systematic literature of the studies. You have to fit your inclusion and exclusion criteria, and on the basis of that you will get, okay, these many studies are important as per my objectives. And then you, by using the software, you have to do the quantitative analysis that we call meta-analysis. So you have to remember every meta-analysis should have a SLR. That's the thumb rule. But every SLR may or may not be converted into the meta-analysis. It depends upon various availability of the data. So when it is required. So next question is, when you have to do the meta-analysis, it's not like you have just thought of on this topic, I want to do a meta-analysis. Because your question, research question should be very clear before doing the meta-analysis. Why you want to do it? What you are going to come out of it? And how your meta-analysis results will help the clinical decision making. So these are some important questions you have to be first thought of before doing any meta-analysis. And particularly as far as little bit experience I got regarding meta-analysis, whenever any controversy in the clinical decision making, physicians are not able to decide whether they have to use these particular medicines in particular type of patients or not. They're not sure about its safety, efficacy. They are not fully clear about the medicines. So these are the certain areas where you can think of meta-analysis. Physicians are giving like supplements, physicians are writing for various disease, but what is the exact role of the supplement in that particular disease, whether it is required for that particular patients, how much dose is required, for how long it's required. So there are many questions where confusion is in a clinical practice. So to resolve these confusions, meta-analysis could help. That will be the purpose of the meta-analysis when we talk about clinical studies. So when there is a confusion, pick up such type of topic where the controversies exist. If you want to do a meta-analysis, suppose regarding use of aspirin in the reduction of heart attack, so it's already known. What is the purpose to do the meta-analysis on such kind of topic where already clear decisions, clear clinical decisions, physicians have no confusion about it. So I hope you got where we have to do the meta-analysis. So this pyramid, maybe you might have seen in many slides also, or many presentations of the experts also, where they talk about first we are doing a preclinical research, in vitro, in vivo, in animal studies. Then there is evidence based on case report, case series. Then there is evidence based on observational studies like case control study, cohort studies. And then we are doing the RCT, that we call randomized clinical trial. And then systematic review, and on the top there is a meta-analysis. When we talk about clinical decision making, so meta-analysis will give you the clear-cut solution for that particular disease or particular medicines or particular medical devices and so on. So as I said, before doing a meta-analysis, you have to perform a SLR. And SLR, as its name indicates, it's a systematic literature review. So the question is how to do a systematic literature review. So you have to follow certain guideline to do a SLR. And well-known guideline is PRISMA guideline. PRISMA stands for Preferred Reporting Items for Systematic Review and Meta-Analysis. So earlier it's first published in 2009 and now it's recently revised in 2020. So whenever you are doing a SLR, you have to be follow the PRISMA 2020 rather than 2009. It's very important. I have seen many research studies where the recent SLR where they have done the SLR, but they have not followed PRISMA 2020. They have followed the PRISMA 2009. That's not a best approach. You have to be follow the recent guidelines. Recent changes has been done in the PRISMA also. So PRISMA, what actually the PRISMA, as I said, PRISMA is mainly the made up of two things there in the PRISMA website: checklist and flow diagram. And checklist set contains a set of 27 items that must be reported in every review. You have to see these checklists, and there is a flow diagram where you have to be give the all the sorting of the literatures, how many studies you got at the initial search, how many studies on the based on title, how many studies on the based on full text. So these checklists, 27 checklists addressing the introductions, what methods, result, discussion section of systematic review report. So this is the I added a screenshot of the PRISMA website. Just type in a Google PRISMA, you will get this website. And in the corner, you can see there is a PRISMA 2020 checklist, PRISMA 2020 flow diagram. So you can click on it and get the PRISMA flow chart as well as the PRISMA checklist. Flow diagram, as I said, means it reports the decision that a review team took as they assess the citations for possible inclusion in this review. And you have to be, you should not draw PRISMA flowchart by yourself. Sometimes what the students are doing, they are making the flow diagram in MS Word, some are doing in a MS PowerPoint. That is not the best way. You just go through this website. In that one, there is a template for the PRISMA flow diagram. Just download it and just fill your number, whatever you are getting from the literature. That's it. No need to create the flow diagram by yourself. Of course, you have to give the citation of the PRISMA wherever you are putting it. So what are the steps in the meta-analysis? So steps in the meta-analysis is, first step is you have to formulate your research questions into the PICO format. PICO stand for P stand for populations or patient, I for intervention, which interventions you want to check the safety or efficacy. C stands for comparator or control group by which you want to compare, and O stands for outcome. What will be your outcome? Outcome can be qualitative, outcome can be quantitative also. It depends upon your research question. Then you have to identify your studies, and then step 2 is you have to determine the eligibility of studies. So you should define your inclusion and exclusion criteria whenever you are doing a meta-analysis. Which type of studies you want to include and which types of study you want to exclude. And it depends on your aim of the studies, your objectives of the studies. Then step 3 is after doing the screening, all the screening process, you have to extract the data from the studies in a data extraction state that we call DES. And then you have to analyze the data in the studies statistically. And there are nowadays softwares are available. We have some freely software also, as well as commercially available software also, by which you can do the analysis. And step 5 is you have to perform the subgroup analysis. You have to check what is the effect of that particular medicines in male patients, what is in female, what is the effect in different age group, what is the effect in different doses, what is the effect in duration of treatment. So there are a number of variables you have to considered, and you have to do the subgroup analysis for better understanding. And then you have to perform the sensitivity analysis, where you have to identify the outliers in your studies. What are the outliers? And after excluding the outlier, what is the effect on the outcome? That's also very important in terms of meta-analysis. So these are broadly the 5 steps which we have to do when we are performing any kind of meta-analysis, whether it is clinical studies or preclinical studies. So data extractions, you have to extract the data in a data extraction sheet that we call DES, and should be extracted from at least 2 independent authors. And this is just for examples I have included. You have to make these columns will be different as per the objective of your studies. So if you want to see the effect of medicines on blood glucose level, HbA1c levels, or HDL, LDL, so accordingly your column will be different. But of course, there should be comparator also. Whether you are going to compare with the placebo group, whether you are going to compare with the standard group, accordingly your column will be vary. Then analysis, and as I said, analysis, for analysis we have a software, and well-known software which researchers are widely using across the globe is RevMan. It's a Cochrane based, and RevMan is freely available. So you can download or install in your system RevMan, and it's very user friendly software. There is not much complicated. But of course, before using the before using the RevMan, you should have an idea what actually the SLR, what you are going to do, what are the different outcome measures, how to calculate the overall estimate. So all these knowledge you should have before using the software. There are another freely available software is R. R is very useful tool by which you can do not only do the meta analysis, but it's useful for other experimental animal studies also, where you want to present different types of animals data, or in terms of clinical studies also. So there are different packages, and R is also freely available, which every students can learn and can explore it much more. There is effect size. As I said, meta-analysis is a quantitative approach where you are pulling the data from the different research studies. So you have to be pulled in terms of effect size. So that can be odd ratio, that can be relative risk, that can be mean difference, that can be mean difference. So depending upon the types of data, depending upon your outcomes, depending upon your primary endpoints or secondary endpoints, if your primary endpoints, suppose I am just giving for example your dichotomous data you have, you want to see this medicine is giving to 100 patients, and out of 100 how many have been died, or how many has been got a adverse event. So in that cases you have to be present your overall estimate measure in terms of odd ratios or relative risk. But when you have a continuous data, like you want to measure the blood glucose levels, you want to measure the HbA1c levels, so in that case you have to be measure your data in terms of mean plus minus SD. So in that case, overall estimate measure you have to calculate in terms of relative risk and mean, so not relative risk, sorry, in mean difference and standard mean difference. So broadly, but of course in further detail you will get to know when you have to select the mean difference, when you will go with the SMD. And then you have to be measure these overall estimate measure with 95% confidence intervals. And in meta-analysis, in every meta-analysis you will find two plots which are most commonly used, and every research paper these plots are there if that paper is related to meta-analysis. That one is forest plot and another one is funnel plot. So what actually the forest plot is, so you can see in this slide, this is the forest plot, and you have to be, this forest plot is generated by the RevMan, and these are the studies, the individual studies from where the data has been extracted out. And this is the aspirin group. There is a total 228 patients, and out of 228 patients, 3 have been died. Event in this case is died. So out of 228 patients who have taken the aspirin, 3 have been died. And there is a non-aspirin group where 204 patients has been administered with aspirin, and out of 204, 20 have been died. So these are the study result of LIU 2021. Like this way, there are a different studies, and different numbers are there. So this is the part of SLR where you have extracted the data. Now you can see this forest plot is generated by the RevMan, and what does it indicate? So this horizontal line indicates the confidence interval. Larger the horizontal line means less number of subject in that particular studies, and less weightage will be given to the that particular study. You know, if number of subject in study is only 10 or 20, or less number of subject, means their weightage will be given to the weightage given to these kind of studies will be less, of course. So you can see in this case the biggest horizontal line is in this particular study. So you can see, just see this this row, you can find there are five subject, and out of 5, 1 has been died. So you can see how less number of subject in this particular study is. So that's why, due to this reason, this horizontal line is larger as compared to other. Smaller the horizontal line means large weightage will be provided to the studies, and there is a less variations among the studies. So you can see if there is a, and this square between the horizontal line is reflecting about the particular estimate, particular overall estimate of the that particular studies. And in forest plot, when we want to analyze a forest plot, you have to see this diamond shape, where this diamond shape is falling. So whenever you are analyzing the forest plot, just see this diamond shape. So in this case, you can see this diamond shape is fall favors aspirin, and this vertical line is one is means null effect. There is no effect. So if your diamond is in the null effect, that means there is no effect of that particular medicines on that particular outcome. But in this case, you can see this fall under favor aspirin group. So you can conclude that aspirin is effective in that particular reduction of mortality of that particular type of patients. So this particular diamond you have to see. And another thing which you have to see in the forest plot is this bold number. So in this bold number, we have calculated the odd ratio. So odd ratio was found to be 0.45, and this is a square bracket. In this square bracket, what actually it is a confidence interval. So 0.36 to 0.57, this is the confidence interval, and this 0.45 is false within the confidence interval, and confidence interval is less than 1. So it indicates the effect of aspirin is significant as compared to non-aspirin group in the reduction of mortality of the patients. I hope it's get. And another thing, in the forest plot, you have to see the heterogeneity. Heterogeneity is very important criteria when we are doing a meta-analysis. As I said, meta-analysis means you are pulling the data from the different study. So of course, when you are pulling the data from the different studies, so of course there is a heterogeneity. One studies might have studied the 18 to 45 years age group. Another studies have a different age group. One studies have a different male, another study have a different female. So whenever you are doing a meta-analysis, if you are getting a heterogeneity, don't be afraid of it, because it's quite natural. When you are pulling the data from the different study, heterogeneity you will get. But important thing is you have to verify what are the possible reason for this heterogeneity. So that is, being a researcher, that is your part. Okay, you are getting 90% heterogeneity. So what are the possible reason? Which studies has contributed much more about the heterogeneity? So that you have to be verified step by step which studies has contributed the heterogeneity. So in this case, heterogeneity is this one. How you can identify the heterogeneity? There is a chi-squares, and there is a degree of freedom, and this is a quantitative measure, I-square, that is providing 77%. So means there is a 77% heterogeneity among the studies which you have pooled. These studies, we are talking about these studies which are included. So this is the forest plot. As I said, next is subgroup and sensitivity analysis. Of course, the clinician want to see, okay, you are saying this medicine is effective in this particular treatment, but which group? Whether it is effective, equally effective in male and female, or it's effective, more effective in male as compared to female. So that information is required to draw. Which age group this medicine is suitable, which individual drugs, which formulations, which strength, which duration of treatment is more effective. So all these subgroup analysis you have to be do step by step and do the analysis. And another thing is sensitivity analysis. As I said, you have to be identify the outliers, and then you have to be do the analysis and see what is the effect of outliers on the outcomes. That is the sensitivity. And selection of models, of course, it depends upon the variability between the studies, and we are preferring the fixed effect models if the variation between studies are small. Otherwise, we have to go with the random effect model. Heterogeneity, as I said, there is nothing to worry about heterogeneities, but of course, being a researcher, you have to be verified what are the possible reason for heterogeneity, because less the heterogeneity, more convincing your result will be for the clinician, for the practitioner. If you are doing a meta-analysis and getting 98% heterogeneity, so clinician will say, how I will believe on the result of your meta-analysis, because you have pulled the studies who have a lot of variations, right? So heterogeneity is broadly categorized into three types: clinicals, then methodological, then statistical. It can be, and there are these reasons you have to find out, and how to identify and measure the heterogeneity. That is a separate topic. But by doing the eyeball test, you can identify how much heterogeneity is there. There is one side or both the sides the studies are falling. There is a chi-square test in forest plot. So a chi-square test provide a p-value to test the hypothesis. So the low the p-value indicate the rejection of null hypothesis. That means low p-value indicate the heterogeneity among the studies. So if you are getting a low p-value, that means there is a heterogeneity. And as I said, I have shown you I-square statistics. So 0 to 40%, there are in various books or in research article, you will get these number might be different, but 0 to 40% low heterogeneity, moderate, substantial, and considerable. Then another thing which important in meta-analysis is publication bias. And publication bias you have to analyze, and particularly we are analyzing first publication bias by the qualitatively by doing the funnel plot, and but funnel plot provides only the qualitative measurement of the publication bias. For the quantitative measurement, you have to apply Bagger test, Eager test. There are different statistical tests by which you will get to know about how much publication bias and that publication bias is significant or not significant. But from the funnel plot, you will only see the whether the publication bias is present or not. It's a qualitative assessment. So in the left corner, if the studies are following these square, these circle means these are the representing one studies, one circle, one study. So if these studies are following in this sides also, that means there is a less publication bias. And how to deal with the publication bias? If you are getting a publication bias, my suggestion is go to the literature. Some studies are not published, include that one also in your meta-analysis. You have to be search much more databases which are available. So this will help to reduce the publication bias. Another thing is sometime students are asking whether when we will go for a registration of the meta-analysis. As in pharmacology, we are, of course, everyone knows we have to be, before doing any animal studies, you have to submit your protocol to the member secretary of IAC, and then meeting will be conducted, and then your protocol will be approved. So in these type of studies also, you have to be submit your protocol to the international organizations for the registrations. So one of the international organization is Prospero, where you can submit your protocol of the meta-analysis, where you can get the registration number. You have to submit all the detail about your protocol, and step by step you have to submit in their portal, and might be you will get some queries sometime, and then resolve these queries, and finally you will get a one registration number. And that registration number you have to be mentioned in your manuscript. Yes, the protocol of this meta-analysis has been registered with this number by this organization. Like that, you are putting in a institutional animal ethics committee number, protocol numbers approved by the IAC. So by a similar way, you have to do it. And common mistakes which students are doing when doing the meta-analysis, there are a search errors, they are doing selection of studies error, data entry errors. They are not able to read the correct values from the research studies. The reason is they are not able to understand the research studies in a proper way. They are they don't know the difference between SCM and SD. They are assuming these are both are same and putting in the Excel. So of course you have to be very careful when you are doing a meta-analysis, because you are doing the analysis of the data which is already published by someone else. And if you are reading the incorrect, so whole conclusion will be goes wrong. So that paper retraction can be done by any time by the editors. So you have to be very careful. You have to cross check each and every data. So it's always advisable, make your box file, put your literature in the hard copies, and put flag, or you have to highlight from where data has been extracted out, and sit with your supervisor and cross check it. Once you will assure, then you will go for an analysis. Challenges is, as I said, meta-analysis are always criticized for the combining diverse type of studies. Sometimes clinicians are saying, okay, you are pulling the data from the other studies, and one study is done in a different age group, another study in different geographical locations, one study is done in USA, another study is done in India. So how you will say these will be combined together? So of course that is the challenges, but you have to be verify it. What are the reason? That's why I said heterogeneity you have to verify very carefully if you want to give some recommendation to the clinical practice. You have to be verified. Sometimes researcher tried so hard to combine the data from the different studies into a single estimate. Sometimes I have seen many students have just motivated for meta-analysis. That's good, but they are very much strict also. Sir, हमें meta-analysis करनी ही है चाहे कुछ भी हो जाए. It's not like that. It depends upon the data which are available at that time, how many studies are available, what kind of data. So there are a number of factors on which meta-analysis depends upon. This is the last points. I am not going to, I hope I am within time. Another last point, this is I think second last slide maybe. Grade is very important. Reason is, grade after meta-analysis. Now, why you are doing a meta-analysis? You want to give some recommendation to the clinical practice. You want to give some recommendation to the policy makers. So if you are combining the studies whose quality is not good, they are biased, there are a number of biasness is there, so they are not of good qualities, so of course the outcome will be of good quality. So how to analyze it? So that analysis we call grade analysis, by which we will see the meta analysis which you have done, what is your raw data, which type of studies you have included, whether they are of good quality or not. Recently I have just attended one ICMI workshop. They have given very nice examples. अगर आपको कोई टोमेटो सूप पीना है, टोमेटो सूप बनाना है, आप मार्केट में गए, वहां कुछ मीन्स गले और गंदे कुछ टमाटर गंदे भी हैं, कुछ ठीक भी हैं, तो क्या आप उनको मिक्स करके सूप बना के पी सकते हो? नहीं पी सकते। तो आपको जब टोमेटो सूप बनाना है तो आप अच्छी अच्छी क्वालिटी के टमाटर उठाओगे। तो वही कंसेप्ट है, आप उसकी एनालिसिस करोगे, जो हमने स्टडीज ली वो क्या अच्छी क्वालिटीज की थी या नहीं थी। So that is the grade analysis. Grade is a systematic approach to bring rating the certainty of evidence in a systematic review and other evidence synthesis. So फिर उसके basis पे you have to give the grade. So 4 grade means further research is not required and you directly recommend to the policy makers and recommend to the clinical practice. अगर आपकी मेटा एनालिसिस के रिजल्ट्स जो भी आपने स्टडीज ली हैं अगर 4 में फॉल कर रहे हैं ग्रेड एनालिसिस के बाद, यू कैन गिव डायरेक्टली टू द रिकमेंडेशन, आप पॉलिसी मेकर्स को सबमिट कर सकते हो। मॉडरेट है, दैट मे चेंज डिपेंडिंग अपॉन द अवेलेबिलिटी ऑफ द डाटा। अभी वो एविडेंस इतना नहीं था, मे बी 1 साल बाद वो चेंज हो सकता है। लो 0 स्कोर इज वेरी लाइकली, वेरी लो इज 1 इज अनसर्टेन। सो मेटा एनालिसिस रिजल्ट्स जब आप ग्रेड एनालिसिस करते हो, देन यू विल फाइंड रिकमेंडेशंस फॉर क्लिनिकल प्रैक्टिस और वेदर इज द रिकमेंडेशन फॉर रिसर्चर। सो जो लो, इट डजंट मीन्स अगर आपका लो क्वालिटी में भी आ रहा है ग्रेड एनालिसिस, इट डजंट मीन्स योर मेटा एनालिसिस, योर हार्ड वर्क इज गो इन ए वेन। इट मीन्स आप उसको रिकमेंडेशन फॉर रिसर्च, नॉट रिकमेंडेशन फॉर क्लिनिकल प्रैक्टिस। क्लिनिकल प्रैक्टिस के लिए या पॉलिसी मेकर के लिए यू कांट रिकमेंड इट। So this is the grade websites where you can download it, and this is the software for the grade analysis. You can install it and directly put the Redman files, and then you can do the analysis. So there is a evidence-based healthcare group, Grade Pro GDP. So you can download it and install it in your laptop or computer system and do it. So conclusion is meta-analysis helps to make better clinical decision, of course, particularly in the complex issues, and SLR is must and powerful tool. But of course, it's always recommended to involve a group of experts when you are conducting this type of studies in a proper way. You need a one persons also who have a statistical knowledge, good statistical knowledge. That person will tell you about which overall estimate you have to select, which you have not to be select. So meta-analysis, you have to be cross-check the data also, whatever the data extracted by one researcher, whether there is a correct or there is any discrepancy. So of course, it's a teamwork. And these are the recent meta-analysis which we have done. Our lab, EBR lab 106 have done. We have done one meta-analysis in COVID time. It's published in the European Journal of Pharmacology, use of steroids in COVID-19 patients. Then we have published in ACS Chemical Neuroscience, Neurological Manifestation, COVID-19 patients. It's also a meta-analysis. And this meta-analysis contains around more than 2 lakhs COVID-19 patients data. Like that, these some of the meta-analysis which we have published in last 1 or 2 years, the International Journal of Clinical Practice and Springer and so on. And this is my upcoming book, which is going to release in August, which is basically on the meta-analysis in clinical research principle and procedures. So every chapters oriented in a proper way, how to do it, what are the different steps. It's going to publish with Springer Nature. So I would like to thank again ISF College of Pharmacies, Chairman Sir, Principal Sir, Vice Principal Sir, Samser Sir, Siddharth Sir, Aarti Ma'am, Avasti Sir, Evelyn Ma'am, Karamjeet Ma'am. There are so many faculties there. So thank you so much again for giving me opportunity. I hope I am able to give some idea about what actually the meta-analysis is in a short period of time. Thank you so much.
Thank you, sir, for your wonderful talk. If is there any question from the student side, because we are having a short of time? Any question from the student side? So I think so. There is a no question, sir. Everything it is being understood by all the students. I hope so. They will do the meta analysis, and it was a very good topic because there is a no need of any animal, any zebra, fish, rat, or rodents, because you can collect the data from the source side, and then you can do meta analysis. So
Yes.
it was very useful. And if there will be any problem related to this, you can directly contact to Dr. Anoop also, because he is very good person, that he will reply you very fastly. Sir, it
Sure,
was a very good topic that you have
sure,
chosen
sir.
for this particular topic on this lecture, because just a 7 year back, when I was in Malaysia, I did also this type of practice on my laptop, and it is a very good topic. So
Yes.
thank you very much, sir, on behalf
Thank
of ISF College of Pharmacy, IAQC, on the basis of IAQC, as well as on the Department of Pharmacology. I welcome you. Thank you very much.
Thank you, sir. Thank you. Thank you
Thank
all.
you.
Thank you, everyone. Thank you.